The abstract presented by Cécile Gruchet is also on carfilzomib, but slightly different. So when carfilzomib, lenalidomide, dexamethasone in the relapse setting, early relapse setting, first relapse, second line, or second relapse, third line, when it was launched in France, that was years ago, it was launched based on ASPIRE design, where carfilzomib is given at 27, 1, 2, and 9, 15, 16 of 28-day cycles. But the thing is that in the area where I work, it's very much not easy and not convenient to the patients, because most of the patients I take care of in the area where I live, which is, it's not a lost place in France, but it's not Paris. The patients have to commute a lot to come to hospital, approximately 1 hour and a half median. Some of the patients takes 3 hours to come to the hospital. So we had to reinvent the way of giving carfilzomib, because it was hardly feasible to have the patient come forth and back twice a week, 3 weeks on a row out of 4 weeks. It would be extremely expensive. Patient will complain from fatigue, where it will be really not quality of life driven. So since 27 times 2 makes 54, and we had experience with 56 in Endeavor, we knew that we could probably give 56 once a week instead of 27 twice a week, still combined to RevDex. So we perform a series of approximately 30 patients. The proof of concept that you can give carfilzomib at 56 once a week, 1, 8, 15, instead of 27, 1, 2, 8, 9, 15, 16, out of 28 days. And we demonstrated, one, that we have approximately the same results as ASPIRE, 2, as good. 2, quality of life convenience is enormously improved. 3, instead of stopping at 80 months the carfilzomib like ASPIRE, we were able to continue beyond 80 months. And the patients who have not progressed, still on carfilzomib, are actually doing extremely well. Plus, 4, at the time the patients get a bit sick of 1, 8, 15 once a week, you can put them into a maintenance profile, 115 or 121, still out of 28 days. And this helps continuing the proteasome inhibitor for a much longer period of time and gaining probably time free of relapse for these patients that are really benefiting and responding from the treatment. While in any other situation and clinical trials that have developed with carfilzomib, at some point you stop the carfilzomib. So we have the feeling that this was a real breakthrough sort of in the way of using carfilzomib and make it really more future for tomorrow. And we were able to convince Amgen that this was really a great change, a great move for their drug. And they have actually launched a couple of days ago a phase 3 trial where they are going, which is called AERO2, where they are going to compare their KRevDex approved with K27, 1, 2, 8, 9, 15, 16 to a KRevDex where K is given at 56 once a week. And so we are very happy, and because a small study conducted in a small place in the middle of nowhere in France was able to drive a major change for the company, which is not very often that we can have such a success. And so this presentation from Cécile Gruchet, Dr. Cécile Gruchet, was an update focusing on elderly patients and focusing on the patients that were able to go beyond 30 months, meaning a much improved PFS compared to ASPIRE.